In this video, we can discuss about pharmacology of corticosteroidal hormones like glucocorticoids and mineralocorticoids. In this, we will discuss about some hormones from adrenal gland and pharmacology of glucocorticoids and mineralocorticoids, its regulation of release, actions, hormonal disorders of glucocorticoids and mineralocorticoids, and drugs used in hormonal disorders. So, as we mentioned before, glucocorticoids and mineralocorticoids are the hormones which are secreted from the cortex of the adrenal gland under the influence of adrenocorticotropic hormone, which is secreted from the anterior pituitary hormone. So this is the regulation of release of adrenal hormone. This adrenal cortex is stimulated by the hormone which is released by the anterior pituitary, that is adrenocorticotropic hormone. And this anterior pituitary is stimulated by the hypothalamus by releasing a corticotropin releasing factor. So whenever there is an need of release of glucocorticoids, hypothalamus will release corticotropin releasing factor. So this corticotropin releasing factor will stimulate anterior pituitary to release adrenocorticotropic hormone, and this ACTH will stimulate adrenal cortex to release their hormone glucocorticoids and mineralocorticoids. And these glucocorticoids and mineralocorticoids together is known as steroidal hormone or corticosteroidal hormone or corticoids. So if there is an increasing glucocorticoids or mineralocorticoids in body, it will negatively inhibit the hypothalamus as well as anterior pituitary, thereby it will decreases the production of CRF as well as ACTH, thereby it will stop the release of adrenal hormones. So that is the regulation of secretion of adrenal hormones. Now coming to the adrenal hormones, adrenal gland have two parts as we mentioned before. It have an adrenal cortex as well as adrenal medulla. So adrenal cortex will secrete their steroidal hormone which is known as corticosteroid or corticoids, which will play in regulation of physiological activities like carbohydrate metabolism, protein metabolism, regulation of blood electrolyte level, immune response, and regulation of inflammation. And adrenal medulla will secrete adrenaline as well as noradrenaline. So in this topic, we will discuss more about these corticosteroids. So what is meant by corticosteroids or corticoids? So the natural glucocorticoids or mineralocorticoid together is known as corticosteroid or corticoids. It includes the natural products as well as their synthetic analogs. So the mineralocorticoids are the corticosteroid with a prominent sodium water retention action. Example is aldosterone. And glucocorticoids are the corticosteroid with a prominent liver gluconeogenesis action. Examples are hydrocortisone and cortisones. Now coming to the regulation of production of corticosteroids. As we mentioned before, hypothalamus will secrete an enzyme which is the corticotropin releasing factor, and that will stimulate anterior pituitary to release adrenocorticotropic hormone or TCH. And this TCH will enhance the action on cortex of the adrenal gland, and that will secrete their hormone, corticosteroidal hormone like aldosterone and hydroxycortisones and dehydroepiandrosterone. So this aldosterone have action in the kidney distal convoluted tubule for the retention of sodium and water. And if there is a hypovolemia and decreasing sodium in our body, that condition will activate the juxtaglomerular cell of our body. So that will release renin, and this renin will convert angiotensinogen to angiotensin 1, and then angiotensin 1 will be converted to angiotensin 2 by ACE, angiotensin converting enzyme. This angiotensin 2 also have an action on cortex to release aldosterone. So that will leads to again retention of sodium as well as water. Now in this adrenaline will produce during the fight or flight when our body require any emergency. So that will release adrenaline, and it will produce stress in higher centers. So that will again stimulate the hypothalamus, and the step will follow as we mentioned before. So this is the regulation of corticosteroid. Now there are some negative inhibition in this process. If there is an excess of hydrocortisone level which will withstand with the stress for long term, so this will negatively inhibit the anterior pituitary as well as hypothalamus, thereby it will decreases the production of CRF as well as ACTH. So this is the regulation of corticosteroid. Now coming to the synthesis of corticosteroid or corticoids, all the mineralocorticoids or glucocorticoids production or synthesis will start from cholesterol, and from the cholesterol it will converted to pregnenolone, and for the synthesis of mineralocorticoid from the pregnenolone it will converted to progesterone, then 11-deoxycorticosterone, then corticosterone as well as aldosterone. And in case of gluco as well as mineralocorticoid production, pregnenolone will converted to 17-alpha hydroxypregnenolone, then it will convert to 17-alpha hydroxyprogesterone, then to 11-deoxyhydroxycortisone, and finally it will convert to hydrocortisone. So this is the synthesis of mineralocorticoids as well as glucocorticoids. Now let's discuss one by one. First one is mineralocorticoids. So what are the actions of mineralocorticoids? One of the prototype drug in the mineralocorticoidal hormone is aldosterone. So what is the action of aldosterone? So these are hormones which are secreted from the cortex of the adrenal gland will enhances the reabsorption of the sodium in the distal convoluted tubule in kidney, and also there will increases the excretion of potassium as well as hydrogen. It will also have same effect in the colon and sweat gland as well as salivary gland. So there will be two chances for the hormonal deficiency, either hypoaldosteronism or hyperaldosteronism. In hypoaldosteronism, there will be a deficiency of mineralocorticoids. So what will happen? This will lead to hyponatremia, because aldosterone have an action to reabsorb the sodium. So if there is a decreasing level of aldosterone, reabsorption of sodium will be decreased, so it will lead to hyponatremia. And aldosterone also have an effect to increase the potassium excretion. So due to the deficiency of aldosterone, it may lead to hyperkalemia and acidosis. And it will be just opposite in case of hyperaldosteronism. There will be an increased aldosterone secretion, so it may result to positive sodium balance. There will be an increased sodium level in our body, and there will be increased plasma sodium, and it may lead to hypokalemia and alkalosis. Now, in case of hypoaldosteronism, if there is any deficiency of aldosterone in our body, we have to use either aldosterone or its analogs. So these are some examples of mineralocorticoids. Natural mineralocorticoid is aldosterone, but these are not used nowadays. And we are using its analogs like deoxycortisone acetate and fludrocortisone, which is a potent mineralocorticoids. So these are used in case of hypoaldosteronism, which will lead to hyponatremia, hyperkalemia and acidosis. So in order to treat the hyponatremia and hypokalemia and acidosis, we can use the mineralocorticoids or its analogs. Now, what will happen if there is an increased aldosterone secretion, or if you are using overdosage of mineralocorticosteroid analogs? So it may lead to hyperaldosteronism. So there will be a water and sodium retention in our body. So it may lead to hypertension, edema, and also it will decreases the excretion, it will increases the excretion of potassium. So it may lead to hypokalemia, alkalosis, and progressive rise in BP. But these are now are rare due to availability of highly specific glucocorticoids. Then gradual rise in BP occur due to the excess of glucocorticosteroid action as well. So these are the adverse drug reactions of mineralocorticosteroids or mineralocorticoids. Now coming to the second corticoids, that is glucocorticoids. Let's see what are the actions of glucocorticoids. First one is carbohydrate metabolism. So glucocorticoids will stimulate the gluconeogenesis, and also they will promote glycogen deposition in liver, and they will inhibit glucose utilization by peripheral tissue. All this process will lead to increasing glucose level in our body. So it may lead to hyperglycemia. And second action is on lipid metabolism. Glucocorticoids will promote lipolysis. So the distribution of fat from the neck and shoulder and face will affect. It is known as Cushing syndrome. There will be a condition like moon face, fish mouth, and buffalo bum hump. So these are the actions in lipid metabolism. Now coming to third action, that is on protein metabolism. Glucocorticoids may cause breakdown of the protein and amino acid mobilization from the peripheral tissue, which may result in muscle wasting and lympholysis also. So these are the protein different metabolism actions on different metabolism of glucocorticoids. Now coming to the electrolyte and water metabolism. Glucocorticoids have an enhanced secretory activity on the renal tubule, and glucocorticoids will cause potassium excretion also. So it may lead to hypokalemia. And in cardiovascular system, the glucocorticoid will restrict the capillary permeability and maintain the tone of arterioles, and it will decreases the myocardial contractility. So applied topically, they cause cutaneous vasoconstriction, and the chronic administration of glucocorticoids may cause hypertension as well as congestive heart failure. Now in skeletal muscle, the optimum level is required for the normal function. In case of hypocortism, if there is a decreasing level of glucocorticoids, it will diminish the working capacity and weakness due to the hypodynamic circulation. If there is excess of glucocorticoid action, it may lead to muscle wasting as well as myopathy, which may lead to weakness. If there is an excess mineralocorticoid action, it may lead to hypokalemia and weakness. In CNS, it may produce mild euphorbia, which is quite common with the pharmacological dose. And in GIT, glucocorticoids will increases the gastric acid secretion and pepsin. So prolonged secretion of glucocorticosteroids or prolonged use of glucocorticoids analogs may lead to peptic ulcer. That is one of the adverse reaction of glucocorticosteroid also. Now in case of calcium metabolism, glucocorticoids will reduce the absorption of calcium as well as it will increases the excretion of calcium. So it will lead to hypocalcemia, decreased level of calcium in the blood. So it may cause different problems like spongy bonds. There is a chance for breaking the bonds due to this hypoglycemia. In blood cells and lymphatic system, it will increases the number of RBC, platelets and neutrophil in circulation. They decreases the lymphocyte eosinophils and basophils, and they enhances the rate of destruction of lymphoid cells. Glucocorticoids will suppress all the type of hypersensitization as well as allergic reaction, and also it can suppress the inflammation and clinical features of inflammation also. So by this action, the glucocorticosteroids or glucocorticoids and its analogs can be used as an anti-inflammatory drug. Now coming to the classification, so we had mentioned there is a two chances for the hormonal deficiency, either hypersecretion of glucocorticosteroid or hyposecretion of glucocorticosteroids. In case of hyposecretion of glucocorticoids, we can use the glucocorticoids and its analogs for this deficiency condition. So these are some examples of their analogs. There are some short-acting glucocorticoids like glucocorticoids which have an action to 8 to 12 hours like hydrocortisone or cortisone. And there are some intermediate acting glucocorticoids. It may act to 12 to 36 hours like prednisolone, methylprednisolone, triamcinolone and deflazacort. And there are some long-acting glucocorticoids 36 to 72 hours like betamethasone, dexamethasone, beclamethasone, then prednisolone and fluticasone. So these are some examples or classification of glucocorticoidal drugs or its analogs. So there are some topical steroids also like beclamethasone, dipropionate, becamethasone, benzoate, betamethasone, valerate. All these are used as an anti-inflammatory drug like skin reactions and etc. for topical use. So these is again classified into potent, moderately potent and mild. So these are the drugs which are used as an anti-inflammatory drug for topical action. Now coming to the adverse drug reactions of corticosteroids, it may include both mineralocorticoids as well as glucocorticoids. So important area is hyperglycemia. There will be an increased blood glucose level while using these glucocorticoids or mineralocorticoids. And second area is cushion habit. There will be an disturbance in distribution of lipid. So it may lead to cushion habitus, the patient may have round face, narrow mouth, supraclavicular hum, obesity of trunk with a relatively thin limb. So the upper part will be thinner and lower part will be upper part will be thicker and lower part will be thinner. So that is the symptom of cushion habitus. And second one is the peptic ulceration. The corticosteroids, glucocorticosteroids will decreases the gastric. Sorry, they will increases the gastric acid secretion. So it may lead to peptic ulceration by using prolonged period. Now, in water and salt retention can be diminished by synthetic steroid like dexamethasone and beclamethasone, and hyper release as well as the long duration of use of corticosteroid may lead to hypokalemia, which may lead to weakness of the muscle, and hypocalcemia due to increasing excretion and decreasing absorption by the corticosteroid. It may lead to osteoporosis, especially vertebra and other spongy bones may lead to osteoporosis, and there will be a chance for breaking of this bone. And long-term steroidal use may cause myopathy, muscular weakness may occur. Then in skin, it may produce fragile skin as well as purple striae. Now, dexamethasone and betamethasone can cause growth retardation in children, and there will be a chance for secondary infection due to the immunosuppression of glucocorticoids, steroids on long-term therapy. And there is a chance for hypothalamo-pituitary-adrenal axis suppression on long-term therapy, and it is maximum for in case of betamethasone and dexamethasone. And there is a delaying of healing of wounds as well as surgical incision due to the corticosteroidal action, and it may cause posterior supracapsular cataract, and also it may cause glaucoma and fetal abnormality like cleft palate. So these are the important adverse drug reactions of corticosteroids. Now, what are the contraindications of corticosteroids? We cannot use, or we have to take precaution while using corticosteroids in case of patient who have peptic ulcer, diabetic mellitus, hypertension, epilepsy, viral and fungal infection, tuberculosis as well as other infection, osteoporosis, herpes simplex keratitis, psychosis, and congestive heart failure and renal failure. So these are the contraindications, or we have to take precautions while using corticosteroid in these kind of patients. Now coming to the uses of corticosteroids. So corticosteroids can be used for two cases. First one is replacement therapy in case of if there is any hormonal deficiency, and second one as an pharmacotherapy or for in case of non-endocrine diseases. Now let's see one by one. So first one is replacement therapy. We can use corticosteroid to replace the hormone in case of hormonal deficiency, like in case of acute adrenal insufficiency, chronic adrenal insufficiency or Addison's disease, and congenital adrenal hyperplasia like adrenogenital syndromes. So these are the different uses of corticosteroid as a replacement therapy in case of hormonal deficiency. Now, due to the action of corticosteroids with the different effect, especially for the anti-inflammatory action, corticosteroids also can be used for non-endocrine diseases like anti-inflammatory conditions. So second use is pharmacotherapy. So we can use for different inflammatory conditions like arthritis, which include rheumatoid arthritis, osteoarthritis, rheumatic fever and gout, and different collagen diseases and severe allergic reactions like anaphylaxis, angioneuritic edema, urticaria and serum sickness. Then also for the treatment of autoimmune diseases like autoimmune hemolytic anemia, idiopathic thrombocytic purpura and active chronic hepatitis. And also in case of bronchial asthma, inhaled glucocorticoid therapy is used as an anti-inflammatory drug to stop or prevent further attack of asthma due to the inflammation. And other lungs diseases like aspiration pneumonia and pulmonary edema. Then infective diseases like conditions which are severe form of tuberculosis and severe lepra reaction and certain form of bacterial meningitis and pneumocystic carani, and also some inflammatory diseases in eye like allergic conjunctivitis, iritis, iridocyclitis and keratitis, and inflammatory diseases in skin like systemic therapy may be needed in case of pemphigus vulgaris and exfoliata dermatitis. And also we can use for the inflammatory conditions in the GI tract like intestinal diseases like ulcerative colitis, Crohn diseases, celiac diseases, and in celiac diseases are inflammatory bowel diseases which are which with exacerbation and remission. So corticosteroid can be used as an anti-inflammatory drugs in case of ulcerative colitis. Then some cerebral edema due to the tumor and tubercular meningitis, and also in case of malignancies, essential component of combined chemotherapy of acute lymphatic leukemia, Hodgkin and other lymphoma. So this corticosteroid is used as along with the anti-cancer drugs for the treatment of different type of neoplasm. Then corticosteroid can be also used as an immunosuppressive agent in case of organ transplantation as well as skin allograft. A higher dose of corticosteroids are used as an immunosuppressant to prevent the graft rejection reactions, and also for the treatment of septic shock with different infectious diseases or infective agents. So high dose of corticosteroid therapy can be used for septic shock. Then thyroid storm, hydrocortisone is used for the thyroid storm, and also to test the pituitary adrenal axis function, dexamethasone can be used. So these are the uses of corticosteroids. So that is all about the corticosteroidal hormone, which include mineralocorticoids and glucocorticoids and its analogs. Hope it is clear. Thank you for watching this video.